Hi, good morning, Jones. My name is Mihiraa. Let's start the warm-up session. Why did you choose to become a nurse?
There are several reasons why I chose nursing. First of all, many of my relatives are nurses, and their stories inspired me a lot. Besides, nursing is a profession with an ocean of opportunities both native and abroad. Above all, this is a service-oriented profession in which I can serve humanity. Hence, I chose nursing as my career.
What is your career goal after reaching your dream destination?
Right now, I do not have any clear management goals. I am very interested in learning about management and leadership and would be interested in any committees that I could participate in and learn. I have lots of ideas and would love to be in a brainstorming group, and I am very interested in the management dynamics of the organization. I feel that I need to join leadership groups to learn and meet new people.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
Your preparation time is over. You can now start your role play.
Good morning. I'm Patrick Paulson, a community nurse, and the GP surgery asked me to pop in. Am I talking to Hensen's parent?
Good morning. Yes, I am his mother.
How may I address you?
You can call me Mihiraa.
Hi, Mihiraa. The main reason for my visit today is just a routine follow-up, as it's been a couple of days since Hensen was diagnosed with chickenpox. I'm here to see how he's been coping and to offer some support and guidance for you as he recovers. First, though, can you tell me in your own words how things have been going since you saw the doctor?
Thank you for coming, Patrick. Honestly, it's been a bit of a rough couple of days. He just seems so miserable, and I feel a bit helpless. He's definitely not himself at all.
I completely understand that feeling of helplessness, Mihiraa. Seeing your little one uncomfortable is never easy. Well, to get a clear picture of what he's experiencing right now, could you tell me a little more about the symptoms you've noticed? For instance, what's happening with his skin, and has he been bothered by a fever at all?
The rash is everywhere, on his chest, back, face, and even in his hair. Some spots are tiny and red, but lots have turned into these little fluid-filled blisters. The worst part is the itching. He's constantly trying to scratch. He also had a fever last night. He was burning up and quite tearful. He's hardly eaten anything today, just a few bites of a banana, and his sleep was so broken last night because of the itching.
Oh, that sounds incredibly uncomfortable for him and exhausting for you. It's very clear he's having a tough time with this classic, widespread rash and that intense itch, which is often the most distressing symptom for a child. I've noted what you said about his reduced appetite and broken sleep, and that fever last night. You're doing a great job observing him, Mihiraa. Now, everything you're describing fits perfectly with the typical journey of the chickenpox virus. Let me explain what happens so you know what to expect. The illness starts with those red bumps, which then quickly become the fluid-filled blisters you're seeing now. This is the most itchy phase. Over the next few days, you'll notice those blisters will start to dry up and crust over, forming scabs. The whole process, from the first spot to the last scab, usually takes about 1 to 2 weeks. It's really important for me to reassure you that, for a healthy child like Hensen, chickenpox is usually a mild, self-limiting illness, meaning his body will clear the virus on its own. Everything he's going through is a normal part of his recovery.
So the crusting is a good sign then? It's good to know this is all normal. I was starting to get really worried. But the itching, how can I help him with that right now? He's so uncomfortable, and I'm scared he'll scratch and cause an infection.
Yes, absolutely. Seeing those first scabs form will be a very positive sign that he's turning a corner, and your instinct about the scratching is spot on. Let's focus on making him more comfortable right now. For the itching, Mihiraa, you can apply a cooling lotion like calamine directly onto the spots. It can be very soothing. Lukewarm oatmeal baths are also wonderfully calming for angry skin. And it's a great idea to dress him in loose, soft cotton clothing, which is much less irritating. Now, for his fever and general discomfort, it's safe to use children's paracetamol, making sure you strictly follow the dose on the bottle for his age. This is very important. Please avoid giving him ibuprofen or aspirin, as these are not recommended for chickenpox. I know you mentioned he's not eating much, which is a common concern, but could I check? Do you have any particular worries about these suggestions or any other questions about keeping him comfortable?
I didn't know ibuprofen was bad for chickenpox. Thank you for telling me that. I only have paracetamol anyway, so that's fine. My main worry is about the spread of this contagious disease.
I'm so glad you said that. You've raised a very real and important concern. Now, another key part of caring for Hensen is also protecting the people around him, because chickenpox spreads so easily. Until every single blister on his body has dried up and crusted over completely, he is still very contagious, so he must stay home from school or childcare. It is also very important to keep him away from anyone who could get seriously unwell from the virus, like pregnant women, tiny newborns, or someone with a weakened immune system. At home, a few simple habits can make a big difference. Make sure everyone washes their hands regularly with soap and water. Keeping his fingernails cut very short is a gentle way to protect his skin, And you could even pop some soft cotton mittens or clean socks on his hands while he sleeps to stop him scratching without realizing it. It is also best if he uses his own towel and bedding for now, and washing these frequently in hot water will help to clear away any germs and keep the rest of the family safe.
Okay, I'll keep him at home with me, and my sister is pregnant, so we'll definitely postpone her visit. The mittens are a good idea. I'll use some thin socks on his hands tonight. But what if he gets worse? When should I actually call the doctor again?
That's the exact question. I want to make sure you have a clear answer for Mihiraa. You need to know when to seek further medical attention. Please do contact the GP promptly if you notice the blisters are looking infected, for example, if the skin around them becomes very red and hot, or if you see any oozing of pus. A persistently high fever that doesn't come down with paracetamol is another key sign, as are signs of dehydration, like a very dry mouth or passing much less urine than usual. Most importantly, if at any point he becomes unusually drowsy, difficult to wake, or seems confused, you must seek urgent medical help. Does all of that make sense? And do you have any final worries before we summarize?
Yes, that all makes sense. It's a lot to remember, but I feel much more confident now. I think that covers everything for now. Thank you so much.
You're most welcome, Mihiraa. I know it's a lot of information, so let's quickly run through the main points to take away for clarity. Henzin has chickenpox, which is a mild, self-limiting illness that will take 1 to 2 weeks to clear completely, with the blisters crusting over into scabs. To relieve his symptoms, use calamine lotion, oatmeal baths, and loose cotton clothing. And you can give paracetamol for fever, but no ibuprofen or aspirin. Remember to keep him drinking with small sips, ice lollies, or watery foods. He must be isolated at home until all blisters are crusted over, and you'll use good hand washing, short nails, and mittens to protect his skin. You now have clear signs of when to call the doctor again. You are doing a wonderful job of caring for Henzin, and he's very lucky to have you. He'll be through the worst of it soon. Take care.